It's time for another Meet the Doc. Mercy Health, Orthopaedics and Sports Medicine, a proud presenting partner of the Skyline Chili Crosstown Showdown. We're here at Mariemont High School with the Warriors head team physician, Dr. Hasan, who's a orthopedic specialist, surgeon, elbow and shoulder specialty. Doc, good morning. How are you today?
Good morning, Tom. Great to be here.
Lots to get to. We're here, and just for those who don't know, this was the original turf field the Moats Group did in Cincinnati many, many years ago. They used it as a display, and they've gone quite a way since then. But we're here to talk about elbows and shoulders. But, Doc, let's talk about you first. And you've been here 20 years in Greater Cincinnati, and I'll go Northern Kentucky. I'm a Northern Kentucky resident. You're over there. We'll talk about your new office, but we're at Dixie Heights this week for our Skyline Chili Crosstown Showdown game, and you spent many years at Dixie Heights High School.
Yes, Tom. I was on the sideline there for, I think, 14 or 15 years, starting in 2001. It's a great school, tremendous tradition. They've also renovated their fields and their sport infrastructure, and they've got a great team and great passion there for football and other sports at Dixie Heights.
Absolutely. Now, before we get into kind of elbows and shoulders and prevention and things that people need to know about that, you guys have a brand spanking new office over in Crestview Hills in Northern Kentucky.
Yeah, absolutely. It's an office that we've been there for well over 20 years, I think close to 30 years, and we recently underwent a beautiful renovation. It's on Thomas More Parkway, a lot of other medical offices right there, and I've anchored that office since I joined, I came to Cincinnati in 2000, and also one of my partners, Dr. Mark Galloway, is head team physician for the Cincinnati Bengals, sees patients there as well, and so it's a office that's humming, and we see patients just about every day of the week there.
So now, shoulder, elbow, your specialty, and let's go shoulder first, and I'm not going to try to get into any of the medical lingo. I'll leave that to you since you're the expert. But talk about shoulders. Obviously, football, we've been out to a lot of campuses, and I see baseball workouts are beginning. Talk about some of the shoulder injuries that are prevalent for high school-age student-athletes and what some of the preventative measures for those can be.
Well, I'll try not to get carried away, but some of the injuries that we see are shoulder instability or loose shoulders. That is, patients or these athletes are unable to keep the ball or the shoulders centered in the socket, and so it'll slip out. If it slips out partially, that's a subluxation. If it comes out like as a result of trauma, that's a dislocation. And we also see separations where the end of the collarbone meets the front of the shoulder blade. That's an AC joint separation. Those are a lot of the injuries that we see. And then the other thing that we want to do is we want to also, as team physicians, try to do preventive strategies and prevent some of these injuries through proper stretching, throwing mechanics, core strengthening the muscles that support the shoulder blade. There's some really good preventive strategies that we can employ.
Talk about shoulders and elbows as well, especially with baseball. You hear it a lot at even the major league level with pitchers being overworked and overused, and there's a reason why in Little League there are pitch counts. What are some recommendations re baseball, especially for pitchers who obviously are throwing the ball a lot, that they need to be aware of?
Yeah, that's a great point, especially in our youngest throwing athletes. We really want to bring them along very carefully, give them some rest. You know, what happens is sometimes you'll have a throwing ace, and the temptation is to put him out on the mound every day, and that's just not the right way to go. The other thing is, besides the pitch counts, we want to introduce some of the curve type and sliders and stuff later. The current recommendation is not to introduce a curveball until 15 or 16 years of age, and so again, we just got to protect those shoulders. The other thing that's really important as well with youth players is that they tend to get really tight in an internal rotation. Velocity is all about generating external rotation or outward rotation, and so we really want to work on stretching that posterior capsule to prevent these sort of very significant deficits in rotation that can lead to problems both at the shoulder and at the elbow. So really stretching and introducing stretching in our young athletes is critical to prevent some of these injuries to the shoulder and elbow downstream.
Well, let me ask, I know we're talking a lot about student athletes, but they obviously have parents and grandparents, et cetera, and people my age. What are some shoulder and elbow issues that you see for people my age, for the parents of these folks, and what do they need to be made aware of?
Well, as we get older, I mean, some of the problems that we run into are wear and tear type issues.
Sure.
You can certainly still have traumatic injuries from playing in a softball league or what have you, but a lot of times the things we worry about are rotator cuff problems. The rotator cuff cuff, or a group of 4 tendons that envelop the shoulder joint, provide some stability and some strength. And what happens, unfortunately, from thousands and thousands of cycles every day of life, the tendon tends to wear out, and sometimes you get the straw that breaks the camel's back. You have an injury, and then suddenly it rips apart. You lose strength. You have pain, especially pain at night, and then you've got to have it checked out to make sure there's not a tear that needs to be fixed.
Doc, let me ask you, I'd be remiss. I know that being a team physician, I know you're one here at Mariemont. Do you still get kind of juiced up about the Friday nights and like the Friday nights being on the sidelines? Because I know you see the kids and the student athletes. How cool is that being a doc on a Friday night being on a sideline?
It is absolutely great. Friday night lights are things that we look forward to. I've been doing this for 20 years, and certainly, we like the pageantry, we like the excitement, we like to see our young athletes, participate with passion. They're growing, obviously, both in mind and body, if you will, getting stronger, and also learning some skills that I think will help. And we also want to make sure that our kids stay safe. So we don't like to see are serious injuries, but unfortunately, that's a part of any sport, whether it's football or soccer or baseball. And so, but we try to be there for our kids as best we can.
Well, here's what I know. If you have an elbow, shoulder issue, he obviously told you why you need to go see him. But I'm not gonna let you go without asking this very important question. You've been here 20 years. Skyline Chili, right? So, I mean, when you go to Skyline Chili, does Dr. Hasan have a go-to, a favorite, or do you mix it up a little bit?
I do 4-way, no onions.
So you get a 4-way with beans, hold the onion.
Yep.
All right, every time?
That's pretty much it.
All right, so if you have an elbow or shoulder injury, we've got just the place for you, especially if you're south of the river over in northern Kentucky. Go see Dr. Hasan and all the other folks. They have physical therapy there, PT available at the office, which has been recently renovated in Crestview Hills. Give that location. It's right there on Thomas More Parkway,
328
right?
Thomas More Parkway. We've got great physical therapists there. We've been seeing patients from 5 to 100 years of age, so young and old athletes are welcome.
Wow, I just hope I'm around at 100 years of age to come see you, Doc.
Me too.
I got a ways to go. But this has been another Meet the Doc, Dr. Samer Hasan, Mercy Health Orthopedics and Sports Medicine. He, again, is an elbow, shoulder surgeon for Mercy Health Orthopedics and Sports Medicine, a proud presenting partner of the Skyline Chili Crosstown Showdown.